Hey guys, what's up? Welcome back to another video. In today's video, I will be talking to you guys about how to take care of a cast, what to do if it's itchy, and any tips and tricks I know and that I give my patients when I see them. So if you are interested, stay tuned and watch this video. Thanks again, guys, for being here and supporting this channel. I appreciate you guys, and let's go straight into these tips. I don't really have an agenda of what to talk about in this video, but I will get through all the things that I can think about at the top of my head. So we all know that you can never get your cast wet if it gets submerged into water. It has to be off. It cannot be wet for more than 24 hours. You can never get your cast wet. What to do if you get it wet? Number one, obviously call your PCP, call your provider, make sure it gets off, because your skin will become really wet. Like if you're in a pool for a really long time, it becomes very white and paley and then very soft, and that can cause other things like infections, wounds, and it just starts to break open. So just make sure that the cast is not on your skin when it's wet for several hours. If you do get the cast just a tiny bit wet, you can use a hair blow dryer in cold air setting. Bring the cold hair blow dryer over the cast and just hold it for a bit, even like in front of a fan. You can also do that. If you still touch the padding and you can feel the wetness in your fingers, then that means you should probably call your primary care provider and just let them know that your cast got wet and you might need to change it out. I know this is not the cast padding, but it's gonna be kind of like this. If you touch it and it seems like a little bit wet, just like that, and you can still feel it, or even worse, if you squeeze it and there's water coming out of it.
Even worse, if you squeeze it and there's water coming out of it.
There, you probably want to get it out. I have made a video where the cast was super wet. I squeezed it and the padding was just dripping water. You need to get it changed out. It's just best to be safe, because you don't want to cast wet on your arm and then you can get infections, and then that whole process is just a whole different level.
'Cause you are the only one. The only one. 'Cause you are the only one. The only one.
A few moments later.
The brand that I've heard that works really well is called Dry Pro. It's blue. I have never tried it, but I've heard very good reviews about it. So if you would rather just take the easy route and just buy a cast cover, you can do that. Or the other option is you can always use trash bags. So what I always tell my patients is wrap 2 trash bags over the cast, and then at the end of the cast, make sure you tie the trash bags, secure it with rubber bands, and then you can also even wrap a towel around it so no water goes inside it, and then bring your arm up and then just out, and then just wash when you're washing. If it's a toddler, I would just do the same thing, but keep the arm up on the tub and then just have his body soak. If it's a leg, you probably want to have like a little seat inside the tub, a plastic seat, of course, or even a plastic chair. Bring the leg up and out of the bathtub while it's covered with the trash bags, of course. Same way for the long leg cast or the short leg cast, wrap a towel around the end of the cast to secure it so no water goes inside it. I've heard a lot of families like to use saran wrap as well. That works really well. And then do the trash bags over the saran wrap. I think that works well too. You don't have to go all out and buy a cast cover, especially if you're only going to have it for a couple weeks. I know they also do have different sizes, but trash bags work the same way. If you have a toddler and you don't want to bring them in the tub, you just want to do sponge baths or even just baby wipes, that's totally fine. Or a wet rag with baby shampoo all over it just to clean your baby. Bring the head behind the sink and just wash its hair. You know, it's just for a couple of weeks while you have this cast on. It's not going to be on for the rest of their life. So just try to work things out while you have the cast on. I know sometimes it's difficult, especially in the summer, because everybody wants to be outside in the pool, in the lake. But do as much as you can. If you have to keep a trash bag on your cast, if you're walking around the lake, if you feel like someone's gonna splash you water, just keep that trash bag on just to be safe. do your best to keep your cast dry, because I know that it is very hard to be in an emergency department waiting for several hours. And at the end of the day, I don't mean to sound rude or, yeah, I guess rude or throwing shade on people, but the casts that ortho technologists do and some of the techs in the emergency department are not the same. Like, obviously people that do it every single day, and you know, that's what they do for a living. We know how to do it very well. And the techs in the emergency department, maybe they're not very, I don't want to say good, but they don't really do that as a living. So they have, you know, they make very bulky splints, or, you know, just very not so nice looking, I guess. But damn! Remember, just try your best to keep your cast dry. All right, so going into tips on what to do if your cast is itchy. Tip number one that I would suggest is tapping on the cast. You can do that if it's itchy. It sometimes works. Other things I've heard is scratching your other arm. Sometimes it helps trick your brain. What you can also do is using a hair blow dryer on the ends of the cast. So just throwing cold air. Make sure it's cold and not warm. Sometimes your skin can get a little bit more itchier if it's warm, so always use cold air. Another thing that I always like to say is anything that vibrates, like a back massager or a toothbrush. Sometimes I even heard like the gym guns that are very vibrations for like the muscle massages. I guess those ones work really well. So anything that vibrates on top of the cast will work. Never ever stick stuff inside the cast. No chopsticks, no pencils, no colored pencils, coat hangers, nothing inside the cast, because if a pencil breaks inside the cast and you can't get it out, if it's there for several days, it can start digging inside your skin and cause pressure sores, wounds, all that stuff. And if you ever get something inside your cast and you can't get it out, please always just call your primary care provider so they can get the cast off and reapply a new one, because you don't want a pressure sore or wound. It's better to just be safe and get it off. Never stick stuff inside the cast.
A few moments later.
So I never say that, but I've heard that a lot of people like to use cold ice on top of the cast. Never tried it, never said it, so it's up to you if you want to use it. But I think those are my top tips for cast itchiness. I think that is it. All of these tips and tricks that I just talked about will work on all casts. So trash bags will work with short leg casts or long leg casts or upper extremity cast. Make sure you try them out. Let me know in the comments below if you have any tips or tricks that other people can use or that I can tell my patients. Let me know in the comments as well if you have any questions, or if you want to ask me anything about casts, let me know down below. Thank you guys again so much for watching, and I'll see you in my next video.